Botox, fillers.
Yeah.
But then we have jaw slimming, then facelifting.
Yeah.
I mean, are these surgical procedures or are they non-surgical as well?
Mostly
Or they're
these
just injectable?
There is a whole category of, let's say, injectable
Okay.
cosmetic procedures. Then there are non-surgical procedures. Then there are minimally invasive procedures, and then there are frank, surgical options. So injectable treatments as such are something which are so wide that there are doctors who just practice injectables and they don't do anything else.
Okay.
So there is so much of injectable technology and compounds and chemicals which can be used. As you said, Botox and fillers, these are one of the most common injectables.
Commonly, used,
Yes.
especially the fillers in terms of
Yes.
lip filling and all.
Yes. So there's a whole range, the whole spectrum of treatments. Botox is, to start with, Botox is a neurotoxin. It's a very potent poison, I would say.
Okay.
But then in a dose which is used for aesthetic purposes, it's not poisonous. It's used in a very minuscule amount, and it's used to weaken or soften the contraction of a muscle. Now,
So it's used to tighten the muscle or something like
to
that?
loosen the muscle, to
loosen the
relax a muscle.
Okay.
So, you can imagine that if I raise my eyebrows, the muscle on my forehead is creating lines.
Correct.
And if I inject a little bit of Botox on my forehead, these lines are just going to disappear or become softer. And similarly, there are lines everywhere in the face.
It's like reshaping that part of the body.
So relaxing muscle, which is creating the wrinkles on the skin. So that's the principle of Botox.
And fillers?
Fillers are, nowadays there are compounds like hyaluronic acid gels, which are safe, which are similar to compounds which occur in our body, and we inject these gels in different parts of the body to create enhancement in tissue. I'm a very conservative surgeon.
What's the life of these fillers?
So hyaluronic acid, I would say, for lips will last for 5 to 6 months.
That's it.
Yes. No, initially people were injecting silicone
So every
oils.
5 months they will have to go and refill their lips.
Do a top up. Yeah.
Okay.
So to start with, people started with paraffin oil. They started with silicone gels, but then it was permanent. But it created a havoc in the tissues. Even though it was permanent, it would cause so many adverse effects. So hyaluronic acid, even though it sounds that very
So
temporary,
where do you draw the line? Fine, this is where if you keep putting the silicone, it will affect your aesthetics to a large extent. Where do you draw that line, saying that I'm a doctor?
Yeah.
You're coming with something which is very irrational
Yes.
as a patient. You're looking to be maybe Kim Kardashian or maybe Ranbir Kapoor
Yeah.
at 65 or 70 years old. And it's not possible.
Yeah.
And where do you draw that line and you say this is not possible or this is going to risk
Yes.
the entire aesthetics of your body?
Correct. So large part of my responsibility is to protect the patient from the patient.
Because from the soul he is very young,
Yeah.
but body is sagging.
Agreed.
So how do you manage that?
Yeah. So, my experience with seeing my own patients, seeing other patients who have done these treatments abroad and different countries and ending up with trouble goes a long way in explaining to a patient what is dangerous, where do you need to stop. And I sometimes, when I see that the patient is still not convinced that, they still want to do that procedure to that extent, I tell them that even if you don't do that procedure with me, please don't do it.
Okay.
So even if you go
But yet he will do it.
yeah, because if you go to 5, clinicians, 5 doctors, one of them will say, okay, let's do it.
Let's do it, yeah.
Yeah. So my practice is based on a principle that, I have to keep the patient safe from not just my procedure, but also from the...
Even drawing the line
Yes.
beyond, moving to ugliness.
Correct.
Because aesthetically it cannot be reversed.
Absolutely.
Then what happens?
Absolutely. So there are things which can go horribly wrong if you overdo things. So you need to stop.
And you could defame your name.
Not just that,
They would come with claims.
Yes, you are talking about
Legal claims.
Yes. So disrepute, claims, complaints. So this is going to happen. Even though this is a very, I would say, tempting offer. Patient says, I want to do 5 syringes, doctor. My friend did, and she was very happy. So I want to put 5 syringes in my face. So that's the time when you think whether she actually requires 5 or 2, or does she even require it? And whether it will be safe for her. Is she going to be worse, or is it going to give an improvement? So that's the time when experience plays, a role. Initially, when a patient comes to you, you think, yes, the patient is asking for Botox. You know how to do Botox. Let's do it. But gradually you come to know what not to do.
Because she or he wants to freeze that age of 35 permanently.
Yes.
Even if they are growing by time.
They
don't want to go older than that, correct?
Nobody likes to be older.
Nobody likes to be older, yeah? So they said, okay, let me be 35 when at 65.
Yes.